Good morning. Today we are going to talk about biomedical engineering and the principal rule of bioengineers. First we need to define this career. Now an specialist energy is going to tell us these definitions.
Biomedical engineering is the application of the principles and problem solving of engineering to biology and medicine. It focuses on the advances that improve human health and healthcare at all levels.
Now we are going to talk about what a bioengineer does.
A biomedical engineer innovates, designs, and develops new technologies to bring solutions in health.
Now we can start with the roles of bioengineering. Let's interview different professionals in the career. Good morning. Can you explain what is bioinstrumentation?
Instrumentation is the application of electrical measurement and electronic engineering principles to develop devices used in diagnosis and treatment of disease. This area involves two other roles: medical imaging and signal processing. Some examples are defibrillators, artificial kidneys, or microprocessors.
That is very interesting. Now let's talk about biomaterials.
Biomaterials are synthetic natural materials used in design of implantable and extracorporeal devices. It focuses on the study of material not toxic, no carcinogenic, strong, and able for implants. Specialists in this area should be involved in designing and developing therapeutic devices such as laser systems for eye surgery and biomaterials to implants.
Okay, now let's talk about cellular engineering.
This area involves solving medical problems at a cellular level. One example is development of devices that help reducing risk in bone marrow transplantation and other cellular therapies. This area can be involved in the production of new vaccines. It consists in the manufacture of biological tissue either ex vivo or in vitro.
This area is very interesting, but let's continue searching more about other areas. Let's talk about biomechanics.
Biomechanics tries to understand the forces and their effects on human body. It also studies the biomechanics of the body and biomaterials. One example of this is the study of forces involved in an accident, helping with the design of safety systems.
And what about prosthetic devices and artificial organs?
This area involves the design of prosthetics that are defined as any internal or external devices that replace lost parts and functions of the neuroskeleton system.
Area is physiology system. Let's talk about this.
This area deals with developing strategies, techniques, and models to understand the function of living organisms. Computational modeling is used in formulating mathematical descriptions of psychological events. This area helps in development of strategies for clinical decision-making experimented systems.
The next area we are going to talk about is clinical engineering.
الهزت الرزت هتاويك التبوم إلا الرياد الشفات بي المصد أو الزين الماخذ الرزن زايدو الازمن مستفاشن الباحة جمنا ما يلديتف والمسين ونستا المستفاحة ما الميسن المستهين إن أرينكنه وشلاح والزمن الزمني إلا هيدمزيت والأيجن الزانن أتاك من زاسك الديرن وحمت وشكالا والهمزي ليخداد والزامرن الديرامزن والمخنت الديراه والزخمزش والديد كالمشن أخدا المين إسيدير المستقي تزمين أغمات عليه زوادم.
And what is biosensor?
The area studies biomedical sensors that are the main building blocks of diagnostic medical instrumentation found in many physician offices, clinical laboratories, and hospitals. They are routinely used in vivo to perform continuous invasive and non-invasive monitoring of critical physiological variables.
The next area is neural engineering.
Is an emerging interdisciplinary research area that brings together neuroscience and engineering methods to analyze neurological function to design solutions to problems associated with neurological limitations and dysfunction. The main goal of this field is to solve neuroscience-related problems and to provide rehabilitable solutions for nervous system conditions.
And what about medical images?
التزوير التبويجي متالیف من المون مرزات الفيجات أنان دي التيفيجات ديران الفازي انفيل evening minlet كيس التي جاكمن عن جاكون أبزن نا الإيردات الزيرن والم وصال الكالدي الزليد الدروم نلجم دليم اللجا الدم الزاد توفر أي تلجلا لفازلي إشان وفيت تجويد بيت من الدين الدكي تنية التشير مثي التزاح المزيد فاخر بعدين بزع أخده التشيد ألا الزيد برندان التزيم أكمي تكوم أكدوات حمد لزكد الحمقوكر يان المند وشهدي الدزيمهن لكاندين الديد وتاين الديفيديها.
What is the next area?
This is an emergent data that applies informatic recompilation and storage to analyze and manipulate information related with biologic facts such as proteins or, for example, DNA.
I have heard rehabilitation engineering. What it is?
It is the systematic application of engineering science to design, develop, adapt, test, evaluate, and apply technological solutions to problems confronted by individuals with disabilities in functional areas. This area is involved in prosthetics.
What is the next area?
Biological and medical analysis is the study of body fluids. It involves the design of devices to facilitate this study.
What is the next area?
Biotechnology is an area that involves biology, chemistry, and other areas to innovate in multidisciplinary areas.
The difference is that bio-nanotechnology involves the design and use of nanodevices, nanoparticles, and nanoscale.
Thank you. These are 15 areas related with biomedical engineering. Follow our fan page and we will answer all your questions. Have a nice day. Goodbye.
Universidad Militar Nueva Granada.